All right, welcome to The Explainer. Today, we're diving into something big from OpenAI, ChatGPT Health. Now, this is a tool that wants to be your personal AI medical assistant, handling some of your most sensitive data. So the big question is this a game changer for healthcare, or is it a privacy nightmare just waiting to unfold? Let's get into it.
So let's kick things off with a story that really gets to the heart of why this thing even exists. Fiji Simo, who's a top exec at OpenAI, she ends up in the hospital with a kidney stone. A resident comes in, prescribes a pretty standard antibiotic, but Simo, she decides to double-check it with ChatGPT, feeding it her own health history. And bam, the AI flags a potentially serious complication. Now, you'd think the doctor might get defensive, right? Nope. She was actually relieved. She told Simo she was glad she caught it, admitting she gets maybe 5 minutes with each patient, and the hospital systems just aren't designed to connect those dots. I mean, that one little moment, it perfectly sums up the exact problem OpenAI thinks it can solve.
And you know what? Fiji Simo's story, it's not some rare exception. Think about it. A whopping 62% of Americans feel like our healthcare system is just plain broken. That's a huge number. And it's that deep, widespread frustration that's basically rolled out the red carpet for tools like an AI assistant to come in and try to help.
Okay, so, Section 1, a broken healthcare system. We're going to look at why patients and doctors are even turning to AI for help in the first place. So what are the specific cracks in the system that a tool like ChatGPT Health is trying to fill? Well, the picture that emerges is a system that's just under this incredible, almost crushing amount of pressure. And it's hitting everyone, both patients and doctors.
Okay, so let's break it down. First up, you've got doctor burnout. I mean, nearly half of all doctors in the US are saying they're burned out. They're just drowning in paperwork and have these insane caseloads where they literally only have a few minutes for each person. Then, you've got the fact that our care is so fragmented. You know, if you have a chronic condition, you might be seeing 20 different specialists, and guess what? None of them are talking to each other. The whole burden of connecting the dots falls on you, the patient. And on top of that, cost and access are just massive hurdles, right? People put off getting care because they can't afford it or can't get an appointment. And finally, the whole model is just reactive. We wait until people are sick to treat them instead of focusing on the proactive stuff. You know, diet, sleep, exercise that can prevent a lot of problems in the first place.
All right, Section 2, introducing ChatGPT Health. This is OpenAI's proposed solution to this healthcare maze. So, with all that as the backdrop, OpenAI comes out with this new, specialized version of its chatbot, built from the ground up to try and tackle these very problems.
So what exactly is ChatGPT Health? The best way to think about it is like a private, secure vault inside the main ChatGPT app. It's this protected little space where you can finally pull together all your scattered health info, your official medical records, data from your fitness tracker, all of it, into one single spot. And then you can actually talk to an AI about it and get insights based on your own personal data. And if you're wondering if people even want this, check out this number, 230 million. That's how many people were already asking ChatGPT questions about their health every single week. And this is before the special tool even existed. It was a massive signal to OpenAI that, hey, people are already using AI for this, but they're doing it in the main chat, which really wasn't built for something so sensitive.
Okay, on to Section 3, your health data, centralized. Let's look at how the platform actually brings your information together. So how does this actually work? Well, the whole point is to tear down what they call data silos. You know how it is, right? Your lab results are in one online portal, your Apple Watch data is in another, your doctor's notes are who knows where. The goal of ChatGPT Health is to become that one central place that brings it all together.
And they've tried to make it super simple to get started. It's basically 3 steps. You find the health space in the menu, you give it permission to connect to your different data sources, and that's it. You can just start having a conversation. You could ask it something like, hey, can you summarize my latest blood work for me? I've got a doctor's appointment tomorrow. Or, show me how my cholesterol has been trending over the last year.
And the list of things you can connect is actually pretty impressive, and it's growing. So, if you're in the US, you can connect your actual electronic medical records through a secure partner they're using. You can also sync up your Apple Health data and all those popular apps, MyFitnessPal, Peloton, you name it. But here's the most important part. None of this happens automatically. Every single connection you make requires your direct, explicit permission.
Which brings us to Section 4, designed for privacy. We're going to examine the security features here because, let's be real, putting all of this super sensitive information into one spot, it immediately brings up the biggest question of all. Is any of this actually safe?
I mean, this really is the make or break question, isn't it? Our health data is about as personal as it gets.
OpenAI knew from day one that if they didn't have rock-solid, ironclad privacy protections, this whole thing would be a non-starter.
So OpenAI's approach here is all about layers of security. First, like we said, it's a dedicated space totally separate from your other chats. Second, everything is encrypted, both when it's stored and when it's being sent. But the third one, this one is absolutely crucial. Your health conversations are not used to train OpenAI's models. That is a massive difference from how your normal chats work. And finally, they give you easy controls so you can delete your data or disconnect your apps whenever you want.
So think of it like a one-way street for data. Information from your general chats might flow into a health conversation to give it some context. Like if you mentioned you were traveling, it might know that. But, and this is the key, your sensitive health information never flows back out. It stays locked inside that health space. That separation is meant to be completely airtight.
All right, Section 5, Promises and Potential Pitfalls. This is our reality check on the benefits and the risks. Because obviously, we have to step back and look at the whole picture here. We've got to balance the amazing promise of a tool like this against the very real and potentially very serious risks.
And this slide really gets to the core tension of the whole thing. On one hand, OpenAI is screaming from the rooftops that this is meant to support your medical care, not replace it. It is not a diagnostic tool. But on the other hand, we have the built-in risk of any large language model. They can hallucinate. They can just make stuff up, but say it with total confidence. And when you're talking about someone's health, that's a terrifying risk.
And you can bet privacy watchdogs are all over this. People like Andrew Crawford from the Center for Democracy and Technology, they're watching this like a hawk. And his point is a simple one. The safeguards here can't just be pretty good. They have to be flawless, totally airtight. Especially, he points out, if OpenAI ever decides to get into advertising. I mean, can you imagine the temptation to use that kind of data? So, to wrap this part up, here are the key limitations you absolutely have to remember. First and foremost, it is not a doctor. Second, a lot of the best features, like connecting your medical records, are only in the US right now. Third, and this is a big one, the fact that it's not available in places with really strict privacy laws, like the UK or Europe, that tells you something. And finally, that risk of the AI just being confidently wrong, it's still there. It's not gone.
So after all that, it really just boils down to this one question. What you have here with ChatGPT Health is a fascinating trade-off. On one side, you have the promise of finally getting a handle on all your scattered health info, of having this powerful AI partner to help you manage your wellness. But on the other side, you have these huge risks around privacy, security, and just plain accuracy. So, the choice of whether you want to trust an AI with your most personal data, well, that's a choice each of us is going to have to make.